treating common injuries.
Thank you. I'm going to, we have about, I think, 35 minutes or so I'll try to make this 20 or 25 minutes and give people plenty of time to talk. Thank you very much for inviting me today. This is kind of a topic I love talking about. My disclosures are, I'm a physiatrist. How many of you know what a physiatrist is? Some. That's more than actually most of the time. And a physiatrist is a specialist in physical medicine and rehabilitation. We do a 4-year residency program after medical school specializing in evaluation and treatment of patients with all types of musculoskeletal disorders, and then usually a fellowship training in sports medicine or musculoskeletal stuff and spine. I work at the hospital for special surgery. Our goal is obviously a comprehensive evaluation and treatment of musculoskeletal problems and then an appropriate rehabilitation program. And you'll see how you move is why we're here. This is going to be about movement. That's going to be an underlying theme to the whole thing here about evaluation and treating common sports injuries. The objectives are going to be pretty straightforward. Kind of what happens to our musculoskeletal system as we get older, because that's going to set the backdrop for talking about things through the ages and what happens to us. I'm going to use back pain as an example because everybody's got back pain or knows somebody with back pain, and what can we do about that. And I'm going to go into just a little bit about regenerative medicine because that's kind of a hot topic and people always have lots of questions about it, and where does that fit into the treatments. And then I really want to talk about gender differences in sports. One of my partners, Ellen Casey, actually does a lot of research on this, looking at the difference between men and women in the musculoskeletal system. It's some really important stuff. So what happens as we age? When we look at what happens in the age of years in our general physiologic function, we usually peak at around 30 and then things just start to slow down. This is like every organ system in our body, sorry. That's the bad news. There's good news. The good news is twofold. One, if you're an active person, that same physiologic function is much higher in an active person versus sedentary. And as I always say, it beats the alternative too, right? So this is what happens to all of our systems, our heart, our lungs, everything, but there are things that we can do about it, and that's what we're going to talk about. Muscle and aging, our strength decreases beyond age about 50, so that at about 65, we're about 75 to 85% of our strength that we were when we were younger. But there's good news coming still. A lot of the alterations that happen in aging are also attributed to younger people who are mobilized. I mean, this guy's got 4 remote controls in his hand. And I grew up in a time where there were no remote controls, and we actually had to get up and walk every time we changed the channel. And so we actually got more activity than these guys. But I think we sit so much now, which is like the worst thing we can probably do for our backs and for generalized deconditioning. And you can see that people that are just immobilized have the same problems that people as we age. And the good news, given enough training, even people, we can have almost the same strength gains compared to young individuals as a result of resistance training as we get older. And this is, I'm not going to have too many studies, but this is one of my favorite ones, that these were people that were 90-year-old nursing home people. They live in a nursing home, they're 90 years old, all of them over 90. And this is at baseline, and then 8 weeks later when they put them on a strength training program, just with very light weights, these are 1, 2, 3, 4 pounders. And they showed that over that 8-week period, there were significant increases, up to 200% increase in strength in these people, and a 10% increase in their muscle size with just 8 weeks of resistance training. So if they can do it, we can all do it, right? So that's the good news part of this. And as we talk specifically about back, this is kind of what a disc looks like. I mean, everybody have a disc problem in here, like all of us, right? The disc is like a jelly donut. Go over to Krispy Kreme's, get the jelly-filled one. That's kind of what it looks like with the jelly on the inside, a nice cushiony thing. As we get older, if you take that jelly donut and put it on the table and leave it, what happens? It's going to dry up over time. So this is what our disc looks like as we get older. Initially, when we're younger, it's nice and juicy and white, and then it kind of breaks down a little bit, and a little bit more of these little cracks in it. It starts to go down a little more, and as we get older, all of our discs kind of wear down. That's kind of normal. So we lose a lot of the shock absorbing. If we lose that shock absorbing, we've got to make it up somewhere else, and we'll talk about that in a little bit about strengthening. But it's interesting because they looked at space travel, because with space travel, you're unloaded, right? We're walking, I don't know if anybody space travel here, but if you're in space travel, there's no gravity, there's no loading on the bones. And you all know about loading on the bones, particularly as you get older. But there's 2 to 3% muscle atrophy with 1 week of space travel, which is about what happens with 1 year of spinal aging. So look at that effect of deconditioning and laying around and not doing things. 1 month of bed rest is like 5 to 6 years of aging. So you can take your disc and start to speed it down, this kind of degeneration, with just the immobilization or inactivity. So you can see where we're going to with movement, movement, movement. So how do we hurt our backs? This is not a political statement, but all 4 of these guys, now one of them has very good form, at least in their sport, right? And he's kind of cheating because he's got a foot fault right here too. So that's about all I'm going to say about that. But the way we hurt our backs, just one way that people have to understand is we're almost always bending with the twist, right? That's what puts that extra load on. Our back is made for going front to back a lot. We don't do this very well. And what are a lot of the sports that a lot of us like to do? They do a lot of twisting and turning. So when we get to it a little bit is we have to make sure we train for that twisting and turning, because that's how we beat up our back a lot. There's lots of options for treating back pain, and we usually start with getting people to understand what happens, that degeneration I showed you before on the space and aging thing, that's normal. So if some doctor says, oh, you have degenerative disc disease, well, you have gray hair and you have wrinkles as you get older too. Okay, that's just part of the deal. You will get that. I guarantee 100% of you will have degeneration of your disc if you don't already. It starts at about age 20 for most of them. That's called aging. Now, that doesn't mean it has to hurt, but that does mean that that happens. So understanding that is very important, as well as understanding that a lot of us will tweak our back. It will hurt for a few days. It gets better. It may wax and wane. The key is how do we make it longer periods between when it flares up and less intense when it does. So a lot of it comes down to modifying activity. Don't sit for long periods of time without getting up and moving around, because that puts a lot more load on our back. Make sure that we don't go into doing twisting and turning sports without prepping our body for those type of things or building up the appropriate strength for the activities that we want to do. Foods may play a role as inflammatory components of a lot of pain things. So a lot of people that have a lot of pain problems will change their diets to go to low gluten and things like that, and lower anti-inflammatory diets that are out there. It may have an effect. But exercise is really one of the cornerstones, and when I talk about what the recommendations will be as people age, you're going to see that a lot of it is what type of exercise, what's cardio, what's strength, when do I do each one, what's important. Again, changing the work site is probably one of the most important things. If you spend 8 or 10 or 12 hours a day at a desk or a computer, how do you break that up a little bit? Take a phone call standing up every half an hour, move around the desk once or twice. There's some simple things to do. Then we get into the more traditional things. Bless you. Some of the general principles of spine exercise with aging is really optimal loading, rest periods, and controlling exposure. So that kind of gets back to that, how long should I sit before I get up and move around? 30 minutes. And then if you could unload for 15 seconds to walk around your desk and sit back down, and maybe do just 1 or 2 kind of arches to unload your back after sitting in that flexed position. So that's one. The second is really building up the muscular endurance for it, and then really challenging the muscles appropriately. And I'll show you, when we talk about this, challenging muscles that are appropriate in sparing the spine, people always ask me about core exercises. What are core exercises? Well, almost any exercise is a core exercise. Core exercises are anything that supports the muscles around your back. We think of our abdominal muscles, but it's our abdominal muscles, our side muscles, our glutes, even some of our lower extremities. All these muscles help support our spine, right? So if somebody says to me, well, where do I start if I'm going to do core exercises? Well, we want to start with the easiest ones that put the least stress on your back, but start to get stronger. So a guy named Stu McGill came up with these. They called them the big 3. So if somebody says, well, where do I start? This is just called a curl up, where you just kind of lean forward a little bit, not the full sit up that we were probably taught as kids. That puts too much stress on our back. This is called a side plank, where you're just kind of laying on the side there, and you'll feel it on the side there, and it starts to tighten up the muscles. And this is called a bird dog, where you take one leg and then the opposite arm, and then you switch and go to the other one, trying to keep your back totally straight there. All of those, if you want to just try them, not right now, we might try them later, and as you do it, you'll feel your muscles tighten up as you do those movements. It's like, wow, that's turning everything on. That's what we want to do, is turn those muscles on so that when we do our daily activities, they're naturally turning on. If I go to pick up a grandchild or whatever, I've got a little bit more support. Aerobic fitness is super important also as we talk about back pain, and again, because walking decreases spinal loading. If we talk about sitting, loads our back, usually standing and being upright unloads. So we're getting kind of a 2 or 3 for 1 every time you walk. One, you're loading your lower extremities, getting those muscles stronger. You're loading your bones and getting them stronger, and you're taking stress off of the back. So even walking is a really good activity for your lumbar spine. And the last thing about sport specific and the spine in particular is people love to golf. I always put this in there because I mean, everybody loves to golf, right? And if you're gonna golf, you sure better practice how you're gonna support your back when you move through all those motions, right? That's a big motion with a lot of turn and a lot of twist. So we give people exercises that are very sport specific. This guy's doing some things where he's reaching back just to get his back and core and trunk stronger, but that looks a lot like the activity. We always talk about functional activity. A functional activity is how do you use your body all day long? That's what the exercise should look like. So a lot of people come in and say, well, show me what exercise you're doing. And they get on the floor and they start showing this. I say, how much time do you spend on the day on the floor? You know, so it may be a way to start exercising, but you want to get to a point where your exercise looks like the activity you like to do. So if you like to do tennis, you better do some exercises that are kind of going back and forth, side to side. If you're riding a bike and walking a lot, you don't need the twisting and turning stuff quite as much. But really important with sport-specific training, whether it's back or any other joint. The second thing I wanted to kind of get into a little bit is regenerativeness. How many of you have heard of PRP, plasma-rich protein? This is a big, hot area, and I think it's gotten way overhyped. They're selling it a lot more than the science is there yet, but there is good science that's moving towards it. I just think there's a little too much hype, particularly in the city, I think sometimes. Anyway, plasma-rich protein is basically a way that you can take blood out of your arm, and you take that blood and you spin it down to all the different parts. Okay, there's different parts in the blood. There's the plasma, which is just kind of more the clear part. There's the red blood cells. That's where we carry all the oxygen so we can breathe and stuff. And then there's this stuff in here called platelets. Platelets is if you cut yourself so you stop bleeding after a little while. If you didn't have platelets, we'd all bleed. And then the white blood cells kind of fight infections. Well, the key is in this little bunch of stuff right here, there's some really good cells in there that help stimulate growth. Growth of what? Growth of about everything. They're called growth factors. So if you have torn cartilage, or torn ligaments, or torn tendons, and you can put some growth factors in there, that's what they call regenerative, it can help heal up some of those tissues. And the thought is, depending on what type of cells we use, can you actually regrow some of those tissues? I think we're not quite there with the regrowing tissues. It's kind of like a bone marrow transplant. If somebody had cancer, you take the bone marrow, you put it back in after you take all the bad cells out, and it regrows the bone marrow again, right? Same kind of thing here, where you're just taking some of that, the good cells that have all the really good, we call them growth factors, and it helps collagen, and collagen is kind of the tissue that tendons are made up, the ligaments are made up of, to kind of get it to heal. So anybody's had tennis elbow for a long time, and it's a tendon injury where there's a little tear in there. And sometimes you try therapy, doesn't get better. You can actually put a little bit of that blood product in there and see if that actually helps it heal up a little bit faster. For some things like tennis elbow, it works pretty good. This just kind of shows you, again, you draw the blood, you put it in a little centrifuge, you have this stuff, it's in a syringe, and you might put it into a joint or you put it into a muscle or tendon ligament. So there's lots of studies going on, and we're doing a lot of studies looking at who responds best to which type of these injections. But it's kind of a big thing that's out there, and again, I think it's a little bit oversold and a little bit overpromised. The reason I show this picture is just that you can see in the background here, there's like an x-ray machine here. So when you do this, it makes the most sense to do it under guidance, whether that's under ultrasound or if it's under x-ray guidance, so that you can kind of see where you're trying to put it. Some people will just draw this stuff up, spin it, and then just inject it in there. Well, who knows if it's even in the right place. It's hard enough getting it in the right place when you have imaging, let alone when you don't have imaging. So if somebody's going to do it, make sure you ask them, are you doing this under imaging, so we make sure we get it in the right place. And if they say, yeah, you don't need to, think again. These are just some examples of some of the areas that they do it. The shoulder, particularly in the rotator cuff, which are the muscles that hold the ball in the socket, is a real common area. The elbow is probably the most common and the most researched for the tennis elbow, you know, on the outside of the elbow that hurts, whether it's from using a mouse and a computer or actually doing tennis. They're doing some in the back and the hip, particularly around the hamstring muscle that's inserted, where they have a tear there. It generally does better right now in muscle and ligament things as opposed to joints, but they're doing more and more now where they're putting it into people with arthritis, particularly of their knee or even of their hip and the ankle a lot, that you put it into the joint and you're trying to see, does it truly regrow tissue, or is it just decreasing a lot of the inflammation and the pain that's in there? Because a lot of people are getting benefit, bless you, a lot of people are getting the benefit of it, but they're not really showing that the bone is growing back or anything like that. So we're still probably a ways away from that, but the point is there's still a lot of promise. It's a reasonable option. I think you use it as an adjunct to a lot of the other things. If the first thing the person says, let's go to PRP, most insurances don't cover it. It costs a lot of money. So I always kind of warn people, I said, just understand what you're doing and why you're trying to get there, but there's probably a lot of future in it down the road. The last area that I want to cover is about gender differences in sports, and I borrowed some of the slides from my partner, Dr. Casey, but there's so much that's going on now. We're starting to understand some of the differences and some of the similarities. You know, for the last 100 years in sports medicine, they didn't study women. You know, they studied around bone density, and that was about it. And Dr. Casey, my partner, and some other folks have really taken it on and said, well, let's look at some of these differences and how do we optimize healing for particularly some of the women-related musculoskeletal problems we see that are different than the men, and see what those differences are. I always love this. This was a boxing match. This guy just got whomped by her. That's great. But you can see, it's so interesting to see what's happened with Title IX back in the 70s, where all of a sudden it became equal to sports. Look at the participation here. This is almost a 10-to-1 men to women in the 70s, and this is like when I was in high school time. And now we're maybe 25% higher as opposed to 10-to-1. This is 1,000% higher. So you can see that the participation is going up, the number of injuries is going up, and so wait, are there differences in those injuries? There's obviously lots of injuries that, lots of differences that we talk about bone related to hormonal changes. Women, as they get older, have a much higher incidence of osteoporosis, but it also has a lot of different effect on ligament and tendon. And ligament and tendon may be more susceptible to injury during different times of the month for women during the period. And this may have implications of, if they're on birth control pills, what kind you give them to decrease their risk of injury too. That's the type of research that we're doing. So it's really important that we understand some of those differences. There are physical differences, obviously, and those physical differences lead into a lot of the different types of injuries we see. Specifically, things like the knee. The knee of women is at a much tighter, much more acute angle than they are at men, so there's a lot more related knee problems with tracking issues in the patella than there are in men. Women also have wider pelvises than men, because you have babies, we don't, and that's the way we've evolved over time. And there's more problems at the hip related to what we call dysplasia, which just means how the ball in the socket forms if it's kind of a little bit looser, which my daughter and my wife both have dysplasia. So again, those are some of the differences in the different, and you can see the muscle mass is bigger in men than women. And because of that difference in muscle mass, they have a lot more injuries where they tear muscles off the bone than women, but they'll get more problems, like I said, between the knees and hips and other areas. So why be active? I mean, I think that it's pretty clear why we're active. The muscle and bone issue is obviously very important. Better balance, all of the other medical issues, whether it's blood sugar, it's overweight, you have more energy. Actually, studies have shown you miss fewer days of work, people that are more physically active too. So there's obviously lots of reasons why. This is so interesting. The fourth leading risk factor for overall mortality is inactivity. Inactivity, that's number 4. So again, we're back into move. Even people, all-cause mortality, people that are inactive, 55% increase in their mortality. If you have cancer and you're inactive, it's 44% increase mortality. And cardiovascular disease, it really jumps up if you're inactive. So you can see that it's obviously hugely important for so many things. And the question is, well, how much do I have to do here? I don't like working out too much. I want to do as little as I can get away with. So when we look at that, moderate to vigorous leisure activity, this is hours per week, okay? So if you go from 0, that's a relative risk of about 1. Just 1 day a week, you decrease it by 20%. You get to 2 or 3, you're here. So as you keep going further out, yes, you can keep lowering it, but you don't lower it as much as just a little bit makes a big difference, okay? And we're going to talk about some really specific numbers to think about that's related to this in a second too. The life expectancy is about 2 years longer than those who burn 2,000 calories per week with exercise. So that's about 8 to 10 miles of brisk walking over a week, right? I think in New York, everybody does that. I mean, it's amazing how much more walking you do in New York than Chicago. facts about women in activity, this is so interesting, more than 60% of the women do not engage in the recommended amount of physical activity. That didn't sound like a lot to me. I mean, it doesn't seem like a lot. And more than 25% of women are not active at all in the U.S. And it's obviously more common in women than men. And social support from family and friends is positively related to the physical activity. So, why not? Well, it's time. It's cost to some people depending on what they can do. There's a lot of limited mobility, and a big part of it is cultural expectations. And what's fascinating about this is my daughter, I'm going to brag on my daughter for a second, she just finished her Master's of Public Health in DC, and she did a study in the school systems in DC. In 4 schools with like 700 kids at lower socioeconomic schools, and they looked at these kids, they monitored how much activity they did over an entire week. And they showed kids at kindergarten, 3rd grade, and 5th grade. And what they showed was the kindergartners were running around like anything. By the time they got to 3rd grade, it was going down. By the time they got to 5th or 6th grade, it went down even more. And women and the girls were much worse than the boys. It was bad in all of them, but it was worse in the girls. So there's cultural and social things that are going on there where like, well, I don't want to compete with everybody in this, maybe I'll just stick to school, or there's not the same push. But it was huge, the difference in what happens over time, and worse with girls and boys, but it was bad in all of them. So as we talk about guidelines, people say, well, okay, what should I be doing? What should my kids be doing when they're younger? And the guidelines that have come out really talk about 1 hour of daily physical activity in this 6 to 17 age year group. And the aim here is for moderate or vigorous aerobic physical activity, at least 3 days a week, and doing some type of muscle strengthening activity also, because this is really formative years. You're building your base that you're going to have the rest of your life. You're going through puberty, and you're able to put on a lot more strength. And one of the key things with kids is trying to mix it up in variety so they don't get a lot of the overload type injuries. So intense training, an hour a day, at least a few days a week, and mixing it up. That's what all the young kids should be doing. Actually, my daughter's actually in the Chicago Public Schools now. She's in charge of that for all 580 schools to get the kids moving at least that much per day. One of the reasons, particularly as the kids start having a period, and what happens is we all hear about the female triad, and the female triad is where you have low energy, deficient energy sources from eating problems. They don't get their period, and then the bones become very osteoporotic or osteopenic. The problem is, if this starts when you're 12, 13, 14 years old, and you've delayed your period by a year or 2 years, you never catch up. So what you do under age 18 will have implications the entire rest of your life. Kind of like the dermatologists, they always tell you that the amount of sun you get under 18, not that it helped me now, because now they told me that I shouldn't have been out in the sun as much, but the sun you get under 18 also affects you forever because it changes your cells. Same kind of thing here. Getting them regular and making sure they're eating well and making sure they have the nutritional things at a young age becomes really important, especially because of the effect of the triad in that group of people that's 6 to 18 years old. Activity for adults, now we're talking about 30 minutes or more of moderate intensity, preferably all days of the week if possible, but at least 20 minutes of vigorous intensity a few days a week. Doing some resistance training. I used to think, well, as long as I'm doing my cardio, I'm really okay. And then I realized when you look at these long-term studies on people, the people that were functionally doing better over time were also doing some strength training. And I guess the reason for that is you get older, it's great if you can jog and everything else, but can you get in and out of a chair easily? Just the strength to be able to do daily activities. So it's really important to add a strength component to what you're doing besides just the cardiovascular health. And then as we get older and following guidelines, there's some other things that become just as important. Again, we want to try to get at least some moderate level intensity exercise and some strengthening, and when not possible, just being as physically active as we can. We have more medical problems as we get older, we're slowed down by a lot of other things, but improving the balance becomes a very important thing. One of the biggest risk factors for people as they get older is if they fall. If you fall and break your hip at like over 80, you're usually dead within a year. I mean, it's that bad that when you fall and break your hip at an older age. So if you can do things to prevent falling, that's going to be huge, particularly. So balance type exercise, anything that works on your balance, standing on one leg, doing partial squats, I love that exercise, and I'll show you how we kind of give guidelines for that. So how do we get started and do this? In the last few minutes, I'm going to talk about that. Well, one of the things is just the physical activity vital sign is, you know, you can basically say, over the last week, how many days did you do at least 30 minutes of moderate exercise? That's a starting point, right? How many days did you do anything? The last week, think in your head. Okay, sedentary, somewhat active, or you meet the recommended daily activity. So there's a starting point to have an idea where you're at. Start with walking. Now this is so interesting. This is a slide, and I didn't have time because I gave the slides to Sharon the other day, and then all of a sudden I read a paper from Boston that actually quantified this a little bit. Because you're like, how many steps am I supposed to do, right? A study that they just did, they looked at women that were over 60, and what they found was that the women that walked 4,400 steps were about 40%, they lived 40% longer than the people who did. So in other words, it used to be like you have to walk 10,000 steps to get enough. What they found is if you do 4,400, you're getting the benefit. Once you're over 7,500 steps, it's probably not that much more of a cardiovascular benefit. There may be other benefits on your bone and everything, but when it used to be like we thought, well, wow, under 5,000 is no good. Actually, 4,400 is probably a decent number at this point because they've done longitudinal studies on it. So, you know, even if you can get up to the 4,000 or 5,000 steps a day, look on your cell phones right now. How many you got today already? Can you get up to at least 4,000 a day, 4,400? More is obviously better, but if you can at least do that, and again, you're loading the bones, you're strengthening the muscle, and you're getting some cardiovascular benefit. What are some of the tips for meeting the guidelines? Put it on your schedule. Exercise in short bouts. Walk up and down the stairs here instead of taking the elevators to mix it up a little bit with intensity. And the gym is really not always a necessity. I think a lot of people feel like, you know, they have to go to the gym to do things. There's lots of stuff that we can do. I mean, I'm not saying you're going to go out there on parallel bars or whatever, but you can see that the bottom line here and kind of the whole theme today is that movement is good, and that's the most important part of this. There's a lot of things that you can do on your own. A number of years ago, I wrote this book. It was called The Couch Potato Workout. And the reason that we wrote this book was, how do we give people exercise and stuff that they can do at home? Because I was tired of people saying, I don't belong to a club, I don't want to go out, I don't want anybody to see me, I can't really do anything without them. And I said, no, you can actually do exercise at home all day long. And one of them used to talk about just the elbows in the back pockets, where I have people just trying to work on standing up straight, because we all do this after a while. I mean, everybody I know. So even just working on putting our elbows back and down, or standing against the wall a couple times a day and doing that, there's an exercise to work on your posture that's simple to do. The standing on one leg, even if you can just do this a few times and go like this and go up and down a few times and keep your balance and then try to do it without holding on. If you can do that, you're killing it right there. And then just do it on both legs. If you can do that, your chances of falling when you're walking down the street and you lose your balance is much, much less. So it's stuff you can do at home. The standing back extension, if you've sat for an hour or so, first thing you do is get up, just do a little bit of an arch to kind of unload your back. So lots of this is stuff you can do on your own. You don't need to have a gym. This was the exercise from the book. This was like the first one. It all started with the toothbrush series, because I used to make my kids stand on one leg when they're brushing their teeth. And I have them brush on one leg, then I have them brush with the other hand, then with their eyes closed, and then going like this, and then actually trying to change positions to really make more of a challenge out of it. So we set up a whole series of toothbrush exercises, and that's what the book got started. You can improvise with equipment. You know, Dad's home one day, and he's got 3 kids, and he's got to figure out, what am I going to do? I want to get a workout in. So I think that's a possibility too, because the thing about this city is people are demanding, and they want to stay active, and they want to stay moving. And so I'm hoping that I at least gave them, this is one of my patients too, you know, put me in home, I put you in the ground. They want to keep exercising, and people want to stay active, and there's a lot of simple things that I think we can do every day that will kind of prevent a lot of those injuries, even as part of the rehabilitation. So I hope we have at least time for a few questions, because I know we have till 11:15. There's always questions. Any questions? Yes?
Is there a difference between living a very active lifestyle, which includes running up steps, walking around all over, sometimes racing or jetting out, and doing real physical, what you would call gym exercises, obviously strength training or whatever? I mean, I'm trying to get a sense of whether, if you leave a very active, healthy lifestyle, and it includes an occasional maybe workout on a rare occasion. Of course, I'm not talking about me. Where's the balance over there, you know, in terms of a real versus a real physical routine.
That's great. I think if you're meeting those goals by a certain number of steps, by doing some type of strength training, that strength training can be walking up and down stairs for 15 minutes. I mean, you don't have to go there. There's nothing you have to do in a gym to be incredibly fit. Bo Jackson was a football player years ago. He had no exercise equipment. He used to sit-ups and push-ups every day. And if anybody remembers what he used to look like, those Bo Nose commercials, this guy was buff, strong, and faster than anything by doing push-ups and sit-ups and running up and down stairs. That's all the guy ever did. So you don't, if you lead that kind of active lifestyle and you're doing 10,000, 15,000 steps because you're walking around New York all day long, the goal is if what you want is to stay physically active, that will help you. If you want to get more fit, you have to push it. And the reason you have to push it is your body responds to stress in a very predictable way. You want to run a marathon, you have to train, and you get better and better at it. It gets easier and easier to do it. Your first day you're running 2 miles and you're huffing and puffing, then you're running 2 miles, it's easy, then there's 4 miles. You have to build it up, and your body responds to stress and load by accommodating. We get bigger muscles, the muscles get smarter, they fire better. So it depends. If you want to stay where you're at and you're in good shape and staying up, perfect. If you want to get even a little bit more fit, and I always say you probably want to shoot for a little bit more, because as you get older, we're going to be doing this, right?
Can I ask a follow-up to that? So along the lines of what you just explained to everybody, you know, there have been periods of my time, again, not about myself, but of course I'm talking about myself, where I've done maybe certain periods of time where I've done good resistance work and worked out for a while, and then either schedule doesn't allow for it, or you just fall off, whatever, and you don't have the time. What about muscle, is the proper term, atrophy then? Because here you may have built certain muscles up substantially, and then, you know, you go off it for months and months on end. There is something about losing some of that. What can you do besides going back into a very active gym routine to gain that back? How do you combat that?
Again, it doesn't have to be the gym, it just has to be something to maintain. But if you're working out at a level and you're getting stronger and you stop, you'll stay there a little bit, but it will start to decrease because you didn't have the stimulus to keep making it stronger.
What's that time frame?
The time frame, you will, this is great. Muscle weakness. There was a study done in the 50s. They put people at complete bed rest, and they lost 1 to 2% of strength per day over the first 2 weeks of complete bed rest. That's complete bed rest. But if you think about it, that means over the first couple weeks you could lose 30–40% of your strength from whatever you were building up. It's not fair, because you lose it way fast, then it would take you 3 times that long to build it back up, right? So the effect of immobility and inactivity is so devastating. So if you're working out hard and you can't work out that hard, just don't go to 0. You know, it's like when people hurt their back and they say, well, I'm hurt and I'm just going to rest for a while. I say, okay, take a day or so, and then I want you, don't go back to 100%, but maybe do 25%. Let's get you moving again, because your body heals better with movement, right? And so the effects of immobilization are drastic. You saw aging there on your spine, and they happen faster than it builds back up. Ain't fair, sorry.
How do you feel about swimming to increase muscle tone? Because I am atrophied in both quadriceps, and doctors have told me to swim. How do you feel about that?
I love that about doctors say swim, because there's like something magical about the pool. Well, even him. Here's the thing about the pool. There's a few things. The pool is wonderful for a number of things. One, you can offload it. So people with really bad arthritis and bad hips and bad knees, and they can't do anything else, try to get them on a bike, try to get them in a pool, something where they're unloaded, so they can at least cardio and strength training. So that's great. The resistance of the water is great. You can walk forward, backwards, walk sideways. It builds core, it helps. All that's great. Here's my issue with the pool. 1, do you have access to a pool? 2, do you like to go to the pool? You know what I mean? So I hate a pool. I don't like smelling like chlorine. I don't like to go to the pool. It's too hard to get there. And the third one is I don't live in a pool. Meaning that functional activity means how do I stimulate muscles to work in the way that they work? Nobody lives in the water, right? Mermaids. But other than that, nobody does. So we try to get people using the pool as an adjunct to the rest of it. Now, if you love the pool and you have access to it, go for it. It's a beautiful thing to keep getting you stronger, and then when you're walking around, you can't walk as much because your knees are bad or whatever. It at least helps build it up so that you may be able to walk further on land with gravity fighting us all day.
You would recommend swimming in addition to all the other?
Yep. Again, if you have access and you like it.
I know you may want to move on to another point. I just want one clarification on my sister's question to you. She was talking about just everyday
Right,
The
that's
things
right.
that we do every day.
Yeah.
And so my question that I want you to clarify on, you talked about walking in the city is great, or going upstairs for 15 minutes is great, up
Yeah.
and down. I don't think that's what she was talking about. I think what she was talking about is in the normal
liked
course,
his answer. It was
a
exactly
normal
what he was
course for many of us, we will go up and down our stairs several times, not 3 or 4, many times a day. We will walk from our car into the store, into this or that, but it's not sustained. It's not a sustained cardio workout of 15 flights of stairs. It's not a sustained workout of going 5,000 steps without stopping at whatever pace. So the question I think I just want to rephrase and get the answer is, does that count for anything?
If it's not sustained, that's what.
It does count, and actually it's a very interesting question because the
Good
American College
question.
of Sports Medicine about 5 to 7 years ago changed their recommendation. It used to be 20 to 30 minutes of cardiovascular exercise, getting your heart rate up to 57 to 78% of the max, which is like huffing and puffing and really getting there, to, you know what, let's look for 150 minutes a week. Let's just get the 150 minutes. You could do it in 10-minute spurts here and 5-minute spurts here, and it's about equal. So that is still important and beneficial. You don't have to do it all at once. Now, if you're training, and depending on what you're training for, it's a different thing, but you're still getting the benefit. That's a whole new thing in the last 5 to 7 years, so that's good too.
So, just to expand on this, if you have, we're talking about muscle atrophy, the relationship between stopping a vigorous workout to regular activity. Would it count like if you're carrying heavy things rather than lifting weights?
Totally.
I mean, is that the same thing?
Bringing the markers.
You're carrying this.
You go to the supermarket, you carry this, touch it.
Well, look at the arm on women, you know, the opposite arm from every time you have a baby, it's like your arm gets way.
That's right.
Okay, so just,
I like this guy.
we like you.
We like you.
We have a lot of fans over here.
Keep going. Yes.
Question about trying to show liquid triangles for
Yes, the triangle.
girls.
Yes.
How do you know if a girl is postponing, if the period, the menstrual cycle is postponed for the reasons you mentioned?
Yeah, I
How can you
think
tell?
the main thing is working with the pediatricians because they're pretty sensitive to this now. And if they're doing sports and stuff like that, I mean, there's an age where most girls will go through their menarche, and it's a matter of some are later, some are earlier. I think when it seems like it's running on the later side, people will look at their nutritional status because it used to be like this was just as all related to your period, there was nothing else. But a lot of it is nutritionally based. So when you're nutritionally deficient, your periods get delayed, which messes up your bones. So I think having the conversation with the pediatrician is the main thing, because what they do is they also evaluate, I don't remember a lot, but they evaluate what the stage is called, Tanner stages of development, like when you get breast buds and when you start to get pubic hair and all those kinds of things. There's time when that should happen, and they can sometimes tell, like, I remember with my son, they said when your feet start to get bigger, that's when they're going to start to grow, you know, those kind of things. So I think that's just talking to the pediatrician about that, because they can monitor that. They're pretty sensitive to it a lot more now than they've ever been, which is a good thing. Yeah?
I'm assuming that yoga has a place in all of this as far as the flexibility and the strength, because a lot of those moves
Yes.
are yoga poses.
And yoga and Tai Chi has been around for a gazillion years, because people a gazillion years ago had you moving motions that look like what you do all day long. They're very functional movements. The one thing about yoga that I always warn people a little bit about, love yoga, my wife does yoga every now and then with her too, is that a lot depends if you've had musculoskeletal problems, depending on what it is, your back, your knee, whatever. Some of the positions are just not easy to get into. You do a downward dog and you got a really long back and you're flexing all the way there, and it may be the best thing to be doing right away. And maybe some of the chaturanga stuff is really good for it, but you have to be a little bit more careful on some of the end ranges of motion. But the beauty of yoga is it's slow, it's flow. They're not doing herky-jerky motions, which is what usually gets into more
And if
trouble.
you have the right instructor, they'll know the modification.
That's right. Most of the good instructors will not push you. I had one time. She goes, no, keep going, keep going. I said, no, but my back. No, you'll be fine. And I'm out of here.
Can I ask you a question?
Sure.
Is a position like an upward dog
Yeah,
okay for
depends on the
a back?
person. I would say
No.
if a normal back without any specific problems, yes, it's fine. But I bet that it's like it's so
So
individual.
you just listen to your body,
Right.
and the nerves don't go there.
Exactly. I mean, you have to.
Can you comment on Pilates?
Pilates is, again, it's a very functional based exercise, and actually Joseph Pilates, when he started it after World War II, whatever, it was healing people who were injured, And it was getting them through very natural body movements because he used a lot of the dance-related stuff. And the beauty of the Pilates tables and stuff is they have resistance that they can give you resistance in lots of different positions. I mean, you can do a lot with free weights too. The Pilates equipment is fantastic. You don't need it, but it is nice, and it's one more way to kind of help stabilize things and build stability. Yeah?
Two here, thank you. First of all, what is your take on sort of the super high impact and then rested? You know, the 30 minutes, the 30 seconds, 30 seconds.
High intensity, yeah, it's fantastic. The reason, but you have to be careful. I do it on a bike a lot. I love to ride my bike, so I will do a lot of high intensity training where I'll ride for 2 minutes as hard as I possibly can. I'm like ready to die, then I rest for a little bit, and then do it again. The reason is what they found is that if you do high intensity training, like Chris Carmichael used to train, Lance Armstrong did it, these little 30-minute programs or 20-minute programs, you get the same cardiovascular benefit that you do with an hour of just kind of going a lot, just not lollygagging, but you're going and just riding but not pushing it hard. That pushing it hard, that's what stimulates the adaptations in your muscle and the cardio. So if you really want to get fit and you want to get into better shape and even faster, the high intensity training on the bike and the aerobic stuff is really good.
Okay, well, taking that one step further, if all over the internet now I've seen
6 minutes, 8 minutes a day, and you do, they give you these sort of newfangled, super high intensity and super relaxed. Do you believe that that notion of the 20 minutes can actually be cut down even further if you do it sort of that way?
I don't know what the bottom part is to that now. The studies that have been done have looked at that kind of 15 to 20 now, but there are 6-minute ones I've seen all the time too. I think there's probably something to it because it's all about, can you stimulate your body to start saying, okay, we got to build back up now, and you have to beat it up a little bit to do that. That's why when you're really exhausted, sometimes at the end, that's when your body's starting to build back up. Thank you.
Thank you very much, Dr. Press.